Manager for the Eastern and Southern Caribbean for the Health Finance and Governance project. I'd like to welcome you all for taking the time in the middle of your busy day to talk to us about making the case for health, resource mobilization for ministries of health and ministries of finance. This is a follow-up meeting to a workshop that we held in March. And before we make introductions, there's a couple housekeeping items that I wanted to share with you about how this is going to work, how best. Please remember to mute yourself so that we aren't hearing your typing or whatever's happening in the background. There is a way to raise your hand if you have a question during the presentation. Where is the hand? Is it at the top of the screen?
It will be right next to the video.
Oh, it'll be right next to the video. The video?
The video and microphone icon to the right of their name.
Oh, okay, there it is. Okay, it should be right next to your name on the right. And then feel free to send a chat at the bottom right of your screen if you are trying to get in touch with the host. We will be encouraging you to raise your hand, and there will be some points in the meeting when we will just unmute everyone if you're interested, so that we can have a more free discussion. So I think to start, it would be helpful probably for everyone if we just quickly set our name and maybe what country and what institution you're with. And we'll do this as quickly as we can so that we can get started and Dr. Mackinnon can lead us into the technical content. So here in Rockville, Maryland, we have two people in the room. Do you want to introduce?
Sure. My name is Alina Sims, and I'm helping with some of the communication and coordination around the webinar.
Mm-hmm. Hi, good morning. I'm Sarah Incinelli, and I'm with the HFG Caribbean program.
And then online, where should we start?
Let's start with Allison English. Do you want to introduce yourself?
Alphabetically. Mm-hmm.
Great. Hi, everyone, and hello again to many of the people on the line. I had the opportunity to meet a lot of you at the workshop in March and have been really excited to contribute again to pulling this webinar together, and I'm excited to have another opportunity to connect.
Great.
Dr. Sebro?
Hi. Hi, good morning, everyone. My name is Dr. Sebro. I'm the Technical Director from the National AIDS Coordinating Committee in Trinidad, in the Secretariat.
Awesome.
Mr. Charan. Mr. Charan.
Mr. Charan?
Hi, my name is Narayan Charan. I'm the Assistant Director in the Economic Management Division of the Ministry of Finance in Trinidad, and I'm also a member of the National AIDS Coordinating Committee.
Welcome. Thank you.
Eric?
Eric Coes?
Hi, Eric.
Eric, can you hear us? Okay, why don't we go down to Ms. Wiltshire? Jacqueline? So, Jacqueline, can you introduce yourself, please? Jacqueline Wiltshire Gay is on the line from the National HIV and AIDS Coordinating Committee, but we can't hear her for some reason. I think the next person, Jonathan?
Hello?
Yes.
Sorry, I just joined.
Jonathan, could you just introduce yourself?
Oh, okay, sure. Yes, hi, I'm Jonathan Calley. I work with the HFG Caribbean team. I've been supporting Trinidad and Tobago with their HIV sustainability plan.
Thank you.
Ms. Yaw?
Hi, good afternoon. I'm Karen Yaw. I'm the Director of Planning, Ministry of Public Health, Guyana. And I'm a part of the high-level steering committee within Guyana that looks at sustainability HIV.
Thank you. Karishma?
Hi, this is Karishma. I work on the HFG project and support the Barbados program. I supported the health accounts a few years ago, and I'm supporting the health spending analysis this year.
Thank you. Marty?
Hello, this is Marty Makinen, health economist working with the HFG project, and I'll be a major part of this webinar today. Happy to work with all of you again.
Rachel? Could you introduce yourself?
Yeah. Hi, this is Rachel Rosen, and I'm with the HFG project, and I have been supporting the health accounts exercises in Guyana and Trinidad.
Thank you. Sandra?
Yes, hi, good morning, everyone. My name is Sandra Jones, and I'm sub-regional advisor for PAHO, and I'm based in the PAHO office in Barbados.
Welcome, Sandra. Shakira? Shakira Mascal is online, but her audio is not connected yet from the Ministry of Health in Barbados. Steve Musau?
Hello, everybody. I'm Steve Musau. I work on the health finance and governance project, and also on the Caribbean team, and I'm a public financial management advisor.
All right, thanks, Steve. Oh, wait, no, that's Cyril Gill. I see, can you unmute him, Cyril Gill? Mr. Gill just joined from the Ministry of Finance and Economic Affairs in Barbados. We're trying to unmute you. There we go. Would you mind introducing yourself, Cyril?
Yes, hi, Cyril Gill from the Ministry of Economic Affairs. Nice to meet you guys.
Thank you for joining. Okay, so why don't we just get started? I'm actually going to hand the floor or the microphone over to Marty Makinen, who will be leading us. We can go on to the next slide, Allison, through the agenda and the content for our day.
Okay, thank you very much, and welcome again to the webinar that follows on from our meeting in March in Barbados, when many of us were together and discussing the issues around transition in financing from dependence on external sources to domestic sources, and began work on sustainability plans. So today, our 1 hour long webinar will feature talking about advocating for the health budget, developing an investment case. We've seen that many of you are working on or intend to work on investment cases, so we'll talk about what the contents of an investment case might look like and ask for any discussion from any of you about your examples you might have or issues that you're facing as you work on investment cases. Our second topic will be in engaging civil society, and again, we know that many of you already engage with civil society, but that engagement needs to change in some ways as you go forward. And here we'll benefit from a presentation by Dr. Ayana Sebro from Trinidad and Tobago about their plans and achievements in working with civil society and moving that forward. Our third and last topic of the webinar will be key performance indicators, and both during our March session and since, we've seen that many of you are interested in key performance indicators, and we saw a keen interest in key performance indicators from our Ministry of Finance participants in the Barbados meeting in March. And then at the end, we will wrap up. So that's our agenda, 3 topics, and a little less than an hour now to discuss all of them. And we're going to stop at the end of each topic for some discussion, and so get your questions or examples ready to bring forward when we get to those discussion periods. So I think we can go to the next slide. Okay, so taking up our first topic of making the case for HIV investment or spending on our HIV programs. Of course, you all know that antiretroviral therapies have helped save millions of lives around the world every year, and that those use of ART reduces viral replication, and that makes ART programs one of the most effective prevention tools that are available to HIV programs. Even though those programs are costly, along with the rest of HIV programming, it's clearly been found by many analyses that their costs are outweighed by the benefits that come from them by saving people from suffering from HIV so that they can be productive contributors to the labor market, and that we can avoid the care costs of caring for HIV orphans and the end-of-life care costs that come from people who succumb to HIV. So it's a bargain to spend money on ART in an economic sense. Let's go to the next one. So in order to make the case for investing in HIV programs and spending domestic resources, it's often been found useful to develop an investment case that describes the kinds of improvements that a country wants to make, or the spending that it wants to do on HIV control and prevention, and to prioritize those investments so that they can maximize the results that come from doing them. So investment cases support the exercise of setting priorities, ensuring that there are stronger returns on investments made in HIV programming, reduce fragmentation, bring programs together, coordinate implementation, and contribute to effective longer-term strategic planning, both financially and for the HIV programs. Next one, please. So an investment case answers the question, what do we want to do and what do we want to spend on? Why do we choose that priority, and how will we implement it or execute it? And the bullets that you see on this slide are typical of the kinds of sections that are included in an investment case. First of all, it begins with a description of the problem to be solved. Next, it takes up what are all the possible solutions to that problem that we considered, and then among the possible solutions, what are the preferred options that we want to take forward, giving a clear justification for that preferred solution. It also includes, of course, what are the expected benefits from the solution to the problem, what are the costs of attaining those benefits, and what are the assumptions that we make in terms of how we've put the solution together. It also discusses what are the risks of going forward with this solution and strategies that have been defined to mitigate or limit those risks. It identifies key activities needed to achieve success and puts them into a timeline. It clearly defines what the resources are that are needed, who or what offices will need to approve the plan, and then a description of what success will look like. And the latter is key to being able to monitor and evaluate the investment as it goes along and once it's concluded. Next slide, please. So the process of developing an investment case includes engagement with all stakeholders, the linking of intended results to stated priorities. It includes doing a costing of the plan so you know what you're asking for and showing that that cost is within a feasible envelope of available resources. And then, of course, a description of how the results will be monitored and evaluated. So, next one, please. So, that's a brief description of what an investment case ought to look like. Your own investment cases will take up the specifics of the issues and the programs that you're seeking to fund in your own country. So at this point, we'd like to ask if there are any experiences that you've had with the development of an investment case that you'd be willing to share, even if you're only part way into the development of your investment case. We'd also be happy to hear any questions you have. And for the representatives of ministries of finance on this webinar, we'd like to hear from you about the method that we just described to get your critiques or your endorsements, and also to hear from you what are the most important features and sections of the sort of template that we've described. So anyone who would like to respond on any of those questions or anything else is now welcome. So please let us know if you have something you'd like to say.
As a reminder, just feel free to unmute yourself if you have something you'd like to contribute.
Hi, good afternoon. This is Karen. Could you show back the slide, the previous slide? Hello? Yes, thank you. Yes, and looking at the what, why, and how, right? What does an investment case include? I must say for us here in Guyana, putting forward, this HIV, as you will know, and as Sarah is there, Rachel is there, and they have been quite involved with a lot of what we have been doing here lately in Guyana. Just completed our health count, and most of all, our sustainability plan for HIV. That too has already just completed and is with the minister for her to discuss with cabinet. Even with that going forward with our budget, 2019 budget, the case has been put forward and the minister has we have approved the treatall process, and the case has been put forward for the 1990 plan going forward for 2020. And I must say, as much as it looks, it is there. I've been going through a document for which also another document for which we would have completed lately too, which is the costing basically for costing for using the resource need model of Spectrum software package, where we would have come up with the funding required for the expansion resources for HIV. Used from this, the disease control, the program manager would have used information from this to put forward a case to finance for us to, at least for sustainability for HIV, to get more money, more funding, especially in the area for ARVs. Because if we're going to move forward with the treatall, one of the biggest cost driver for us going forward is the area for medical supply. And that in itself, I think the budget itself put forward there is over 100 million, Guyana dollars basically. So looking at this, the justification, the justification case put forward is one of the key important aspect of things for which I know finance will be looking at. And most of all is to get basically, well, the cost assumption. If we don't do this, what is going to be the implication, basically? And at the same time, the epidemiological background also for that. So those are some of the things that at our end in Guyana had to be put forward in order to, to put forward that case to finance to get the money. And for me, I would think the case put forward, we may not get all, but we will get most of what we're asking for. So it's not necessarily a fear that you wouldn't get an increase. I think that might be some of it that I can share at this time.
Great. Thank you for sharing that, Karen. That was excellent. So that I think you mentioned almost all of the categories that are shown on this slide and what you were talking about, and you kind of added some other ones like the epidemiological background, and that is part of the description of the problem. And you mentioned the cost of not acting, and that's kind of the flip side of the expected benefits, is the cost of not acting. So I think that's an excellent example of using this concept of an investment case to make the case for the resources for your ARVs. Are there other comments or questions that anyone would like to raise about investment cases? If not, maybe we'll move on to our second topic, because we don't have a great deal of time, so let's move ahead. Okay, and our second topic is engaging with civil society. It's a clear and strategic process for engagement between government and civil society, can enhance communication, transparency, consultation, and alignment, and civil society can act as an important intermediary between governments and the populations that they serve to make a two-way connection in terms of information, both conveying information to the population and soliciting feedback and making it a real dialogue, with the dialogue meaning both ways. And then civil society frequently possesses specialized expertise that both can inform policy making and facilitate implementation of reforms and provide specific services, especially to key populations. Next one, please. So to talk about engaging civil society in a very specific case, we're going to call on Dr. Ayana Sebro, who's volunteered to tell us about engaging civil society in the sustainability planning that she's participating in, maybe leading, in Trinidad and Tobago. So please go ahead, Dr. Sebro.
Good morning, everyone. Thank you very much for the opportunity to share a little bit about the Trinidad and Tobago experience from our recent sustainability planning meeting. I'd first like to acknowledge the other members of the team. I'm definitely not doing this by myself. So I'm acknowledging Jonathan, Callie, Dr. Sarah Intanali, Ms. Rodney, Dr. Beverly Andrews, Dr. Kevin Antwine, Ms. Rima Lewis, Ms. Charon, Dr. Laptis, and Mr. Roger McLean. So some of the comments that I will make reflect some of the work done by the team with wider support from national stakeholders. I want to kind of start by saying that the National AIDS Coordinating Committee in its makeup is an intersectoral committee made up of government, civil society, academia, multilateral and bilateral partners. And so our very makeup includes a wider team. We recently hosted the sustainability planning meeting, and it focused on 3 areas: the financial sustainability, epidemiological sustainability, and donor transmission. So that's just a little background bias, and I've been asked to share a little bit about the civil society engagement and its role in the sustainability planning meeting and role for sustainability meeting. So I would like to acknowledge too that given the design of the NSCC, civil society inclusion is something that that government sees as very important and has seen as very important from the very beginning of the national HIV epidemic. The civil society has access to populations that government cannot access. They have less bureaucratic mechanisms that allow them to adapt easier to innovation to reach hidden populations. And the human resource mechanisms that they have may also mean that they're able to have greater impact with less investment. So that being said, civil society engagement through social contracting has been something that government has been doing for a long time. And so CSO was very involved in the meeting we had, and so some of the comments you see reflect that. But I want to share specifically on the social contracting mechanism. So that the slide here reflects our efforts to support greater improvement in this particular process. And there's a significant amount of activity that has been going on nationally related to civil society, that's led by civil society. In the meeting, one of the things that was discussed was the importance of having work plan meetings as a mechanism to share information, limit duplication, and look for opportunities for programmatic synergy. The NACC has a mandate to coordinate much of the activity on the ground, and so the discussion to implement this has begun, and we have suggested that it be civil society led so that it could reflect a little bit wider some of the views and interests of civil society. So there it is. So that is the first thing. Next slide, please. There has also been some discussion as part of our sustainability planning to include CSOs to be able to sensitize civil society a little bit better to some of our financial mechanisms. In the social contracting mechanisms of civil society, we give grants to subventions, which is large grants and small grants. And by sensitizing the civil society to the processes and our budget cycles, it is thought that there would be an improvement in terms of the communication around the process, and also improve the way that the grants are submitted, and could potentially improve some of the returns for civil society. Specifically with respect to CSO and HIV service delivery, the country engages civil society in terms of HIV testing, treatment, and also risk reduction interventions. Just kind of going back to the previous presentation, we don't really have a sense of the variance in the cost, because I don't know that an investment case has really was done prior to this to determine, the cost of, for example, testing in a civil society agency versus testing in a government agency or treatment. So, in terms of our review and that whole discussion around developing an investment case, developing an investment case and examining some of the legal frameworks, we do have some opportunity to refine our processes so that we can look at how we can look at new processes coming from civil society and look at opportunities to scale up. There's been increased involvement by some of the there needs to be some increased involvement by technical teams. At this particular point in time, where you have agency getting, for example, a subvention or a grant, there would be the requirement for the civil society agency to provide government with feedback from a financial viewpoint, as well as a report in terms of its programmatic activity. Sometimes there is not inclusion of all the teams at the government side to be able to review with civil society the project that is actually being implemented through that social contracting. And so there's room for review of that process to try and improve what is done. So I shared a little bit about the framework in terms of the fact that we would govern some of these grants if we're giving grants to persons by either an agreement from cabinet, or even, for example, minister would give approval for the activity, and then we would proceed with a memorandum of understanding, or simply a legal document in terms of this is what these funds are being granted for this particular process, and then there's the feedback in terms of the reports, and then evidence in terms of how the funds have been expended. We propose that the CSO forum that we would want to look at be seen as a work plan meeting and as also an opportunity for us to get wider feedback to a much wider audience, so that much more stakeholders can be aware of some of the activities that civil society is doing. And then there's also the opportunity for us to reduce duplication, overlap, and look for opportunities for synergy. There have been attempts previously for us to form an umbrella network for civil society organizations. And there have been some challenges there, but we're hoping to be able to revisit this. And this is something that was suggested in the last meeting. So cross-cutting issues in terms of civil society engagement as it relates to the social contracting is the inclusion of the entire team in the process, to really look at the systems that exist for civil society engagement in your respective country. Can some of those systems be improved or scaled up? How is the engagement monitored? Be it by policy, is there a policy governing how this is done? Is there a legal framework in terms of a cabinet note, minister approval, MOU contracts? It's definitely something that should be seen as a bi-directional engagement, because civil society often has a lot of capacity to be able to pass on their experiences and be able to scale up capacity of government officers in terms of their experience with populations that they may not necessarily provide services for on a routine basis, and vice versa. If this is something that another country is proceeding, interested in doing, one of the things that I'd like to close by saying is that there's always opportunity for you to review. There's always opportunity for this process to be continuous, which is kind of where we are in Trinidad. Thank you.
Thank you, Dr. Sebro. Okay, so Dr. Sebro told us all about how Trinidad and Tobago is engaging with CSOs, how they're included in the planning processes, how the government is examining its legal and regulatory framework, policy framework, and approval structures for being able to continue to contract with CSOs for the specific services that it can offer, and it's reaching the key populations that are difficult for government to work with. She told us also that it's important to inform CSOs about the government funding cycles that they might not be used to, and also about the reporting requirements that come with the grants that might be made to CSOs. So all of that, I think, is very interesting and probably has parallels in the other countries. So we'd like now to hear any questions you might have for Dr. Sebro, and also anything about your own experiences with civil society engagement, if they parallel those that were presented, have been different in some ways. Tell us about any challenges that you faced and ways that you've addressed those challenges to overcome them. So we'll open up the floor for any of those discussions. Questions for Dr. Sebro, or answers to these questions, or any other comments you'd like. Go ahead. Let me, not hearing any other questions, ask Dr. Sebro a question. When you discuss with CSOs their reporting requirements, what kind of feedback do you get from them about those reporting requirements?
So that the reporting requirements are often part of from a social contracting perspective, the reporting requirements are part of the process, so that the agencies are often aware of that from the beginning. So and it has historically been tailored to the particular organization or the particular activity. So the agencies that I have worked with in the past have been willing to report, and are often, they're happy to share some of the information. There are some times where, for example, there are some agencies where you might have to assist in terms of what may need to be submitted, but I don't think that we've had challenges, not in my experience. I don't know if Mr. Charan could share differently, or if anybody else on the team is online that may want to share differently, but I haven't experienced any challenges.
Okay, well, having started on the committee that issues and evaluates the grants on behalf of the AIDS committee that I am on, some of the challenges that I have seen is that the reporting sometimes is very, very poor, and it doesn't allow us sufficient information, or doesn't provide sufficient information to allow us to evaluate whether or not the group should be provided with the funding. So whereas the idea may be a very good one, very little information sometimes is provided that doesn't allow me to actually say yes or no to the funding that will stand up when the Minister of Finance or the Auditor General asks, why did you do this?
That would seem to be a big challenge. I wonder, you mentioned that there's the possibility of forming an umbrella group of the CSOs, and maybe an umbrella group might be an opportunity to offer some training to the CSOs about those reporting requirements. I imagine they include both financial reporting and programmatic reporting, both how much money they spent, what they spent it on, and what they achieved through the program. And as you're indicating, there's some challenges that with poor quality on that. Maybe doing some group training might be a way forward. What's your thoughts about that suggestion?
That would be very good. We have started to try to do that in Trinidad, so that we have working on providing some guidelines, and we are hoping that the civil society members who are trying to participate with the government will follow the guidelines, although sometimes they see the guidelines that we are putting forward as more of a bureaucratic type of regulation, and they know what they are supposed to do and we do not. So we have to find a middle ground where I can satisfy the regulations that I have to follow and still provide services and funding to the people on the ground who actually know how to do the actual implementation.
Great. Yeah, I think that it's very important to find that middle ground to meet the requirements, but also not to be overly burdensome to the civil society organizations so that they can continue to do their good work. But they should be willing to meet those requirements, especially since if they don't, it puts their funding at risk. Are there any more items of questions or suggestions or experiences that anyone would like to bring forward about engaging with civil society?
Hello? Can you hear me? Hello, can you hear me?
Yes, please go ahead.
Yes, this is Jackie Wilcher from the National HIV/AIDS Commission of Barbados. And we in Barbados, we have been doing the social contracting with civil society since around 2012. And we are still constantly refining it. And we have had some of the same experiences which Dr. Ayana spoke to. For instance, we've been having to do those workshops to build a capacity so that they're able to meet the legal obligations under the contract, because they will do the work, but again, the reporting, the financial, the fiduciary management and stuff, we've had to work with them on that. It is very results-based, so it must include monitoring and evaluation and those reports. And that is how they managed to draw down on the tranches of under the contract. We do a lot, particularly to help us with research and data collection, because we are very focused on getting the evidence. So they do a lot of the work through their projects on getting the evidence, and the legal contracts are usually negotiated with the civil society organization. So we get something which they get, we get, and it's not, as you say, overburdensome on the civil society organization, because normally they're volunteers. They have the passion, but sometimes not the infrastructure.
Great. Thank you very much for that comment. And I think in your comment there was the notion of tranches of funding that come with reporting. So as an incentive to make sure that they report in order to qualify, if I'm getting you right, for the next sum of money, they need to submit their reports. So I assume that you think that's a good method.
Yes, because they have their deliverables.
Right. Very good. So thanks very much. Any additional comments or experiences that anyone wants to share about civil society engagement?
I'm sorry, afternoon. I was just going to add that just that there's that experience in terms of the drawdowns in Trinidad as well. And some of the experiences will vary depending on the maturity or the strength of the civil society agency that you're engaging with.
Great. Thank you for that, Dr. Sebro. Okay, I think let's move on now to our third topic. Oh, go back to that other slide, please. Sorry, I left that out. We want to also call your attention to a tool that you might want to consult that's been developed by the HFG project, a tool called Engaging Civil Society in Health, Finance, and Governance, a guide for practitioners, and it helps with many of the steps that you've heard about in the discussion that we've had. Let's go on to the next one. Okay, let's turn now to key performance indicators. And again, many of you in your plans for sustainability planning mentioned the desire to use key performance indicators to define key performance indicators. And you heard in our March meeting from Ministries of Finance that they'd like to hear about key performance indicators as a way of justifying the spending that you're asking for, the money that you're asking for. So in this first slide, we have a generic definition for key performance indicator, or KPI, that is a quantifiable measure used to evaluate the success of an organization, employee, etc., in meeting objectives for performance. Let's go to the next one. And as we heard from the Ministries of Finance at our March meeting, they speak in numbers. They liked very quantifiable terms to help them understand what line ministries and line programs like HIV programs and Ministries of Health are doing with the money that they get. And so for the dialogue between Ministries of Health and HIV programs and Ministries of Finance, KPIs should be as quantitative as possible, and where it makes sense to use quantitative indicators. But it's also the case that not every indicator needs to be quantitative. We can have some that are qualitative as well. Let's go to the next one. So some examples of KPIs for HIV program transitions, the transitions from external financing dominating to increased domestic resources paying for programs, include the overall HIV performance metric of the 90-90-90 approach that came up in the March meeting. Another kind of KPI that might be considered is the percent of external funding that's replaced by domestic resources. A third category is having a budget line item for just the kind of thing that we talked about in our last segment, for contracts with civil society organizations that serve key populations. And a fourth category might be What are the prices that we pay for the antiretroviral drugs that are important cost elements in the overall program? These aren't the only ones, but these are some very salient examples, and we'll go into each of them a little bit in a few minutes. There are many sources of data, especially quantitative sources, and some of them are mentioned at the bottom of the slide, the Sustainability Index and Dashboard, and the National Health Accounts that many of you are working on. Next slide, please. So let's look at this HIV overall performance metric of the 90-90-90 targets. UNAIDS, the global organization focused on HIV and AIDS in 2014, set a global target for the year 2020. And that global target is that 90% of people in each country will know their HIV status. The second 90 is that those who are HIV positive, 90% of them would be on antiretroviral therapy, the treatment with ARVs. And the third 90 is that 90% of those who are on the ART, the treatment, would achieve viral suppression. And there are at least two ways to measure overall program performance in terms of the 90-90-90 targets, and that those are making progress from your baseline, where you started, in terms of those three categories, towards that target of reaching 90-90-90, and your comparison with peer countries. And in our next slide, we have an example from a fictional country that we call Jasmania. And Jasmania has the kind of data that you see in this graphic, and it's an example of key performance indicators of both how Jasmania is doing in terms of progress and how it compares to its peers. Jasmania is in a region where its peer countries, along with Jasmania, are members of a Council for Regional Economic and Social Cooperation, or CRESC. And so in this graphic, we see each of the three categories. First one on the left, knowing your status. Second one in the middle, HIV positives who are on ART. And one on the right, the viral suppression rate. And the light blue bars represent where Jasmania was in 2014. The dark blue bars represent where Jasmania is in 2017, or at the end of last year, 2017, and the yellowish bar represents where its peer countries in the CRESC Council are in 2017. If we go to the next one, we can see that Jasmania is making progress on all of its indicators. The dark blue bars are higher than the light blue bars in all three categories. So it's making progress from 2014 to 2017. Next one. And Jasmania is doing better than its peers in the CRESC Council region on the middle indicator, the HIV positives who are on antiretroviral therapy, but it's not doing as well as its peers in the other two categories, knowing status and viral suppression rate. Okay, next one. And then as we look at the 90% target, we see that Jasmania has quite a ways to go yet to get to 90%, since that's at the top of this graphic, by 2020. So though it's making progress, it still has a ways to go. So this is an example of how data on the 90-90-90 categories can be used to show both progress, comparison to peers, and where a country stands in terms of getting to the ultimate target of 90% across the board in all three indicators. Next slide, please. Okay, let's turn to possible KPI in terms of percent of external funding replaced. As you know, HIV programs have benefited from substantial external support for a long time, but now that support is going down and is coming to an end in the coming years. The Global Fund, USAID's PEPFAR, and the development banks are all reducing or completely phasing out their funding, especially for middle-income countries like those in this represented in this webinar. So to be able to sustain HIV programs, that external funding has to be replaced, but also there's the possibility of achieving efficiencies that can reduce the need for that replacement. So let's go to the next slide and see an example again from our fictional country of Jasmania. And here we have 4 bars that show the shares of total funding of the HIV program that come in the red portions of the bars from external funding, the purple portion of the bars from the government of Jasmania, and where there can be savings through efficiency costs that you don't need to spend money on are represented by the green parts of the bars. The bar on the left is for where Jasmania started in 2014. The second one is where Jasmania is in 2017. The next one is the plan for Jasmania for 2018, and the one on the right is the requirement where Jasmania needs to get to by 2020, and by that time the external funding will have shrunk from 70% in 2014 to 10% in 2020. Next slide, please. So here we see that Jasmania has begun to make the transition in 2017. The red portion is smaller than it was in 2014. The purple portion is bigger, and there's been some efficiency gain. There's a little bit of green at the top. Next slide, please. But we also see that Jasmania has a long way to go and has to accelerate its efforts to make that purple part as big as it needs to be 20, and to make the green part as big as it needs to be in terms of efficiency gains by that time in order to continue to deliver the results for the HIV program that previously were heavily dependent on external funding. So this is, again, an example of how to represent quantitatively in a way that would appeal to ministries of finance about the replacement of external financing. Okay, next one. Third category is a budget line item for contracts with civil society organizations that serve key populations, the topic of our previous session. Of course, an important part of achieving the 90-90-90 is reaching key populations. CSOs have been key to reaching the key populations. So it's important to have government budget allocation to be able to contract with CSOs so they can continue their critical work when external funding ends. So once you get that budget line item, that's a qualitative indicator that you've accomplished something. And we heard in the previous presentation that working with CSOs is much more than just having that line item. There's much more to it than that, but that's one key piece. Next one, please. In terms of prices paid for ARVs, because ARVs are a very expensive part of the overall program, making sure that you pay as low price as possible for ARVs is very important. So some of the ways that you can show that you're paying low prices is by showing trends in the prices you pay for the ARVs that you've continued to use over time, and ideally those would be going down. You could also make comparisons with peer countries in terms of what prices you pay and what prices other countries that you consider peers pay, and with global prices. And in some cases, there are opportunities to switch to new drugs that are better and cheaper, such as the DTGs that have recently appeared in the sets that are available, and compare, as you make those switches, the prices of the old drugs to the new ones that are replacing them. And then finally, there's the opportunity to join mechanisms such as the OECS pharmaceutical procurement services to ensure that by joining together with your fellow members of the OECS, you can get competitive prices. So again, some examples of how to put together KPIs, key performance indicators on prices paid for ARVs. Next slide, please. In the slides that follow, there are a whole set of additional indicators in different categories that will make available to you describe indicators in terms of inputs, outputs, outcomes, efficiency, their strengths and their weaknesses. Okay, and I won't go through them all now in the interest of time. So keep going one more. But one other tool that's available is a tool from the HFG project on developing KPIs, a toolkit for health sector managers that recommends that KPIs follow the SMART procedure to be S for specific, M for measurable, A for achievable, R for relevant, and T for time-bound, SMART, SMART key performance indicators. Next slide, please. So we have just a couple of minutes left for discussion. Do you have any experiences you'd like to share with developing KPIs? Tell us about any challenges you faced. Tell us about any solutions you found to address those challenges, or ask us any other questions you might have about KPIs. So we'll open the floor.
Yes. I would like to share a few of our Guyana's experience with the development of key performance indicators. I must say, for those that you would have explained, we are basically using, in effect, all three, in a sense, to move forward with our resource mobilization through governments, and that, as we all know, as a result of decreasing donor funding. For Guyana, however, we have already been, for the past, I would say, 4 years as such, has been increasing our budget as a result of donor funding decreasing. First, we had PEPFAR that reduced, basically come off and just basically doing, looking basically at technical assistance, and now Global Fund basically now is another one that is going. And as such, I would say we were put in a position where we, I must say, we had to drastically put measures in place, and as a result, we have the sustainability plan, and then the other aspect is the health accounts aspect, for which within that would have a number of recommendations would have showed up based upon the results showing. One of the things that we had to look at, and which we are basically moving forward with, is how do we shift resources, which is one of the key aspects of things, is to shift resources from one area into next, and that's basically moving resources from curative to preventative. The other aspect too is also our focus area, focus more on primary health care, and at the same time government stepping up their resource allocation, which for us, again, in our health accounts, has shown clearly what we've been saying all the time. Rachel is there, and she can also, and Sarah's there too, where we have presented the results, which was quite remarkable, where it was shown clearly 62% as against 35% of donor spending, where government has really been clearly putting the effort into putting resources towards basically taking up their position in increasing resources. The other aspect with it, 99, that's another indicator for which we're using also in going forward to represent, put forward our case, so government to finance nationally in order to get more resources. And I would say that in effect is key for us, and it's being used and accepted by government. The other aspect for which is new, is the whole aspect of engaging civil society, because originally for us, civil society used to be engaged through the donor, and as a result of donor, and that has been the concern over time. How do we now engage civil society? How best can government, because government for us here in Guyana, it's not such an easy, straightforward case to like put money like that into an NGO, to do certain things, and then you don't want to duplicate services that is being done at the public, in a sense. So to duplicate it in another sense. So the discussion for that has been quite intense. I listened to what Trinidad has presented pertaining to engaging civil society. I think if I was clear, if I probably
So,
got it.
Karen,
Yes.
I'm going to have to interrupt you, even though you're telling us lots of interesting things, because our time is up, and we have to end this. So clearly, there's great interest in sharing information across these topics as you work towards common kinds of sustainability plans, developing investment cases, working with civil society, monitoring process with KPIs. So we hope that you have in mind many additional steps that you might take as a result of these discussions, and counterparts across your countries that you might talk to about how they approach common problems.
Yeah.
So with that, I'm sorry that our time is up because our discussion is quite rich, but our time is up. So thank you all very much, and thanks to all the organizers as well.